Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. This is our COVID-19 briefing for British Columbia for Monday, April the 12th. We're honored to be here on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. Tomorrow, Tuesday, at around 3 o'clock, we will be providing a written briefing with updates on case counts, hospitalizations, and other relevant issues in the COVID-19 pandemic in British Columbia. The same on Wednesday, and we'll be back here Thursday afternoon, at which time Dr. Henry will be providing some updates on the COVID-19 pandemic, including new modeling for you. So with that, it's my honor to introduce Dr. Bonnie Henry.
Thank you and good afternoon. So today we are reporting on 3 periods of time. From Friday to Saturday, we had 1,283 new cases diagnosed in British Columbia. Saturday to Sunday, an additional 1,036 new people were diagnosed with COVID-19, and in the last 24 hours, 970 new cases were diagnosed, for 3,289 new cases over the past weekend, bringing our total number of people who have been diagnosed with COVID-19 in British Columbia to 112,829. Of the new cases, 740 are people who live in the Vancouver Coastal Health Region, 1,957 people live in the Fraser Health Region, 167 in the Vancouver Island Health Region, 299 people live in the Interior Health Region, and 125 people live in the Northern Health Region. We currently have 9,937 active cases all across the province, of whom 368 are in hospital currently, 121 people in ICU or critical care. We have 15,900 people under active public health monitoring and 101,216 who have recovered from their infectious period. Over this past weekend, we have 18 new deaths from COVID-19, people who were in hospitals and primarily around the province, bringing the total number of people who've died from COVID-19 to 1,513. As always, we think of those people who have loved ones who succumbed to COVID-19, and we know how challenging it can be right now, particularly. And our condolences and our thoughts go to the families and communities and the care providers who have lost loved ones. We have 2 new outbreaks to report at the Dufferin Care Centre and at Sunset Manor. That brings us to 6 active outbreaks, 3 in long-term care, 2 in assisted living, and 1 in independent living, and 7 in acute care facilities. We do not, at the moment, have updates on the percentage of cases that are variants of concern and the details today due to a data issue. However, we are at approximately 50% of cases across the province who now have one of the variants of concern, primarily the B117, and the additional data will be presented on the BC CDC dashboard later. And to date, we've delivered over 1,112,101 doses of all 3 COVID-19 vaccines across British Columbia. Of those, 87,744 are second doses. And as of today, we know that people 65 and older, Indigenous peoples 18 and over, and people who have received their clinically extremely vulnerable letter can book appointments. Additionally, people age 55 to 65 are eligible, people 55 and over are eligible to get vaccinated with the AstraZeneca vaccine through pharmacies around the province. I'd like to reiterate that while the AstraZeneca vaccine is on pause for people under the age of 55, it is a safe and effective vaccine that's been used in millions of people around the world. And if you are older than 55, I strongly encourage you to get vaccinated as soon as possible. The safety signal that we've been following around the world has been investigated thoroughly, and we are waiting for Health Canada to review that data from the European Medicines Agency and from the UK that came to light last week, and to give us more guidance on the use of this important vaccine here in British Columbia and in Canada. As well, now people 40 years of age and older can register on our Get Vaccinated platform to get onto the registration system, and then you will be contacted when it's your turn to book your appointments as they become available in your community. I also want to talk a little bit about the parallel worker program that we had initially started, primarily with the AstraZeneca vaccine. We've continued to focus using that program on transmission hotspots, so high-risk workplaces in the highest spread locations in our province. And that does continue, and we have ramped up that in the last week. So this includes first responders, fire and police services in particular. We know that most of our paramedics have been immunized through our program for healthcare workers. But it includes school staff and childcare staff in hotspots. Right now, we know that the greatest transmission and the highest risk are in communities in Fraser Health, and that is where we've been targeting these programs in the last few days. We will also continue to focus on other hotspots around the province using vaccines to help put the brakes on transmission where we're seeing it happen worst. And that includes places like Prince Rupert and Terrace, and recently Whistler, where we've had ongoing transmission despite our ongoing efforts at outbreak management. We will also be targeting specific neighborhoods as we have more information on where vaccine is needed most. But I will say, for those identified within this program, particularly workers, please be patient. We cannot go to everybody at once. Like our age-based program, not everybody will get it at once, but everybody will get it and have their turn. And we're focusing on where those areas of transmission are highest to start over the next few weeks, and it will spread out from there around the province. This is, I don't need to say, our third wave. And knowing this, we need to chart our best path forward to manage this wave in British Columbia. We have recognized from the very beginning that the impacts of shutdowns and the measures that we take in public health don't affect people equally. And that has been an important consideration that we have taken all along in our management of this pandemic here in British Columbia. But the goals have been the same. Our focus has been on doing all we can to keep people from getting sick, and particularly to keep people from being hospitalized, needing ICU care, or dying from COVID-19. But at the same time, we have put in measures to ensure that our health care system can still be there for everybody who needs health care when they need it in British Columbia, and that can be done safely. But along with these important programs of minimizing the impact of this virus, we also want to minimize societal disruption, because we know that the measures we put in place, as I said, don't affect people equally. And looking after the physical, emotional, and mental health of everybody in British Columbia is something that we take to heart. And for us, that has meant taking only as much restriction as we need to suppress the virus and ensure that our healthcare system is functioning and that people are protected as best we can. And that has meant we've been able to safely keep most businesses open across the province. But as this surge has increased, we have had to take additional actions to address those places that are highest risk, and those are those highest risk indoor settings. COVID-19 is a virus that is transmitted by people to people. We've known that from the very beginning, and there's some settings where this happens more easily, and as we've seen these variants of concern that are more transmissible increase in our province, some of those settings have become more risky. Often we are transmitting the virus to those that we are closest to, our families, our communities, our workplaces. As we face a surge in new cases and hospitalizations, we need to focus on the things that will have the biggest impact to break the chains of transmission and slow the spread. And we in public health across this province are working to do just that with every single case and every single contact that we connect with. But it's up to each of one of us to do our part as well. It is our collective efforts that have made the difference so far and that will continue to make the difference as we weather this part of our storm. To get to the end as quickly as possible, there are things that we need to do now. And that includes staying home, staying in your immediate neighborhood as much as possible. So if you live in North Van, you should not be traveling to Langley or to Richmond. If you live in the Lower Mainland, you should not be traveling to the island. If you live in Penticton, you should not be going to Sun Peaks or Oliver or Kelowna right now. We need to only do those types of travel if it's essential and nothing more. But we do need to get outside every day. We know there are things that we can do safely, and mostly that means doing them outside and keeping our distance and our safety measures in place. For our own physical, but emotional and mental health, everybody should go outside every day, whether it's in your backyard or your immediate neighborhood. Take your family, take your pet, but find some time to go outside and stay small and stay within your household, your work, or your school cohort only. Seeing a small number of people from outside your household outside is allowed, but it needs to be done in a small way, and we are discouraging even that right now. Public health teams across the province are also doing all we can to slow the pandemic down, and if you are contacted and told that you must self-isolate for the 14 days of the incubation period, this is not optional. And businesses, if anyone on your team is ill or has been told to self-isolate, then you need to support them and give them the ability to stay home until they are better and no longer contagious to others in your workplace. Tonight, the new expedited workplace closure provincial health officer order will come into effect. And this order, as we talked about last week, is an alternative to shutting down sectors. Public health has been working hard with businesses that have been impacted by this virus. And it's through no fault of one business. It's not about blaming them. It's about supporting businesses when this virus comes into your workplace to make sure that we can stop the transmission and prevent it from spreading to workers. This means public health teams, with the assistance of WorkSafe BC, will continue to expand our ability to close businesses for 10 days when there have been transmissions in that workplace, to help stop those transmissions and make sure the COVID safety plans are in place to protect everybody in those situations. The list of closed businesses will be published on the Health Authority websites and BC CDC so that we all know where we're having these challenges. This is about supporting businesses when COVID makes its way into those workplaces. We want to keep businesses open and keep people working because we know how important that is, not just for the economy, but for our health, our physical and mental health, and our communities. But if business is causing transmission, we need to take action. Keeping people working with good COVID safety plans and supporting businesses where transmission has happened is the purpose of this order, and we will work together to make sure that can happen. For our frontline healthcare workers, and I've met so many of you, treating patients in critical care particularly, for people who have loved ones who are not yet vaccinated, and friends who have gone to work without pause throughout this pandemic, show them that you care. Show them that we can, in British Columbia, work together to get through this. You may feel that your individual actions don't make a difference, but I'm here to tell you again and again, they do. We are part of the team here in BC, and we can support our communities as more and more people are protected with vaccines. This is where we need to work as a team, more so than ever. We need to support each other to get immunized. We need to support each other to stay home if we're feeling unwell. We need to support each other to stay together by staying apart when we're out or when we're in contact with people who aren't in our households. So I am asking everybody, let's get together, do our part today, tomorrow, and next week so we can get through this pandemic and we can look towards the summer when we'll have opportunities to be together again. And at this time of the marathon, of this storm that we've been in for so long, it's so easy to get discouraged, to get angry, to get frustrated. And now more than ever, all of us have to remember that we don't always know the story of that person who's doing something that's driving us crazy. We don't always know what's going on in people's lives and how they're holding it together. So now more than ever, we need to continue to be kind, to be calm, and to be safe. Thank you.
Thank you very much, Dr. Henry, and I wanted to start by sending my condolences, those of the Premier, those of the government, I think those of everyone in BC, to the families, the friends, the caregivers of the 18 people who passed away over the last 3 days related to COVID-19 in British Columbia, 9 from Friday to Saturday, 5 from Saturday to Sunday, 4 from Sunday to today. 9 of them lived in Fraser Health, 4 in Vancouver Coastal Health, 2 in Interior Health, 2 in Vancouver Island Health, and 1 in Northern Health. This pandemic has affected people all over British Columbia, and we are thinking of these people today, because it is, of course, a very difficult time for us to come together and grieve because of the very public health restrictions that we talk about every single day. And so we want everybody to know in these circumstances that we are with them. Dr. Henry talked about the level of hospitalization, 368 people in hospital today. That's not a record, but it is getting close to a record in BC. 121 people in critical care. I've reported regularly in the pandemic on hospital bed occupancy rates. I'm going to do so today and talk about this issue in slightly more detail. Currently, in terms of our overall bed capacity and occupancy rates, total base beds and surge beds, there are 11,934 total beds, and 3,314 of them are vacant. That's an occupancy rate of 72.2%. Of our base beds, our regular beds across our hospital system, which are 9,394, 876 of those are vacant. That's a base bed occupancy rate of 90.7%. In terms of critical care, we, in our overall base and surge bed capacity, total occupancy rate is 54.5%. The total vacant beds, therefore, is 353. On our base beds in critical care, the base bed occupancy rate is 77.3%, meaning there are 122 vacant base beds. That said, and while hospital occupancy across the system is manageable, in critical care especially, the overall capacity remains good. There is concern with occupancy of close to 100% in a number of our key hospitals, and especially in Metro Vancouver. Vancouver General Hospital, Lions Gate Hospital, Surrey Memorial Hospital. In recent months, there have been significant issues at the University Hospital of Northern BC and at other hospitals. So while a number of actions have been taken today to better support our staff teams, because even though there is bed capacity, and even though, as I reported on Thursday, ventilator utilization is about 20% of our active, of our in-service ventilators right now, meaning we have enormous ventilator capacity, and that's not an issue. This obviously has a profound effect on our staff, both qualitatively. The idea of people in critical care who are severely ill from COVID-19 has a profound effect on them and on their families, and we think of them today. And the fact that our critical care teams have done better really than anywhere else, anywhere, in supporting people in those circumstances doesn't mean that being in critical care is anything other than profoundly serious for everybody's health involved. I just note a number of actions we're taking today. The Provincial Health Services Authority is redeploying 8 critical care trained nursing staff to support the Fraser Health Authority. The critical care occupancy and need to redeploy is impacting surgical slates at Surrey and Abbotsford and Royal Columbian. 2 slates in Surrey, 2 slates in Abbotsford, and 1 slate at Royal Columbian for the week of April 12th. That is for the redeployment of staff. Occupancy overall has affected some surgical activity in Vancouver Coastal Health as well, an estimate of 8 surgeries today. Just to get a sense of what a surgical slate is, a typical OR room runs 7.5 hours per day, and some surgeries take more or less time, as you would imagine. For example, 4 to 5 hip and knee surgeries can be completed in a typical slate. At the other end, perhaps 15 to 23 cataract surgeries can be completed in a typical slate. So we've made these adjustments in order to ensure that we have sufficient support for our staff in critical care, and those adjustments have been going on since the beginning of the pandemic, and they will continue. We'll continue to monitor the daily occupancy rate and take specific actions to reduce stress on the health system as needed through this redeployment of staff. This will not be like last year, where we canceled en masse our scheduled surgeries, but will be targeted and for as short a period as possible. However, this is a real reminder to all of us how important it is to keep focused on public health orders and public health guidance at this time to reduce transmission. The real growth in cases is having a real impact on healthcare workers, and for the first time beginning to impact our effort to ensure individuals receive needed scheduled surgeries since we relaunched the surgical renewal plan in May. In short, it is critical to keep our hospitals open and safe and open to everyone to be able to come in, and to do that, we all need to ensure that we're following public health guidance. On a more positive note, as you'll note, the number of hospitalization in Northern Health, where we've made some deferrals of surgeries over the last period, has been a fact of life, especially at University Hospital of Northern British Columbia. We're seeing a decline in hospitalization, in part related to immunization efforts in the north. So I'd like to just move on briefly to talk about vaccination. As Dr. Henry's noted, 1,112,101 doses have been administered in British Columbia. That's 1,024,357 people. That's almost 24% of those eligible to be vaccinated in BC. It's over 80%, well over 80%, 85% of those over 80, over half of those over 65 have now been vaccinated. Those are extraordinary numbers in those age cohorts in particular. I just want to mention issues around supply, because there's interest about that. And just note that in the case of Pfizer, the Pfizer vaccine, which is at the core of our age-based and clinically vulnerable campaigns, to date, as of today, BC has received 888,810 doses of Pfizer. 828,867 of those doses have been administered as of yesterday, and the remaining 59,943 doses are in clinics going into arms over the next 2 days. We expect this week to receive a shipment of 138,000 doses of Pfizer vaccine just in time to continue the program. BC has received 248,000 doses of Moderna. Almost 80,000 of them have arrived since April the 3rd. 194,540 doses of Moderna have been administered, and just 54,360 doses are with health authorities to be used in the days ahead. We expect towards the end of this week to receive a shipment of 105,900 doses of Moderna, again, just in time. This is the shipment we were originally expecting to receive last week. We also expect to receive a further 42,900 doses of AstraZeneca. That AstraZeneca has been distributed through our pharmacy network and is being delivered in pharmacies across British Columbia. In short, our team delivering our Get Vaccinated campaign across BC is doing an extraordinary job. If we have significantly more capacity then we have vaccine. We could deliver more if we can get it. And I think our teams have done a very good job, and they can be proud of it, and you can already see its impact. But if we could get more vaccine, we would love to have it. We have the vaccine that we have, and we're making, in some cases, difficult decisions to deal with outbreaks in different health authorities. But I think our teams are doing a very good job. We hope more vaccine will be coming, and if it is, we will be delivering it expeditiously into the arms of British Columbians. I just want to remind people that there is no way around it. There's no shortcut. There's no easy way to get to where we need to be. We must get our case numbers down. We must do it for people to ensure that our hospitals are protecting and provide service to everybody. And our BC third wave requires us to continue to do the hard work we did in our first wave, our second wave, and that we know by now, that each of us knows by now, makes the difference that matters. I ask everyone to recommit themselves today to following public health guidance and public health orders for the ones that you love, for your own safety, and for everyone in your community. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour 3 périodes de référence de 24 heures chacune. Pour la première période de référence, qui s'étend jusqu'au 10 avril, nous avons eu 1283 nouveaux cas. Pour la deuxième période de référence, qui s'étend jusqu'au 11 avril, nous avons eu 1036 nouveaux cas. Au cours des dernières 24 heures, 970 nouveaux cas se sont ajoutés. Il y a eu 18 nouveaux décès liés au COVID-19 durant ces périodes de référence. Nous offrons nos condoléances aux familles et aux amis de 1513 personnes décédées de COVID-19 et à tous ceux qui ont perdu des êtres chers au cours de cette pandémie. Parmi l'ensemble des cas confirmés de COVID-19, 368 personnes sont actuellement hospitalisées, dont 121 en soins intensifs. Merci beaucoup. Thank you very much. We're happy to take your questions.
Thank you, Minister. As a reminder to everybody on the phone line, please press *1 to enter the queue. You'll be limited to one question and one follow-up only. First question this afternoon is from Justine Hunter, Globe and Mail.
Thank you. First of all, just on the vaccine delivery, you say you're expecting some more just in time. Are there contingency plans, or are you quite certain that's on the way? I'm wondering how you allocate if you don't get that, Pfizer particularly.
Yeah, the Pfizer is really the workhorse of our program, the age-based program in particular, and thankfully it is the one that has the most reliable delivery schedule now after our unfortunate shutdown of it earlier on in February or January, February. So we do plan the clinics out, and the reality is if it doesn't arrive when it's scheduled to arrive, we have to cancel clinics. So that's how close we are doing with the Pfizer. It's a little bit different for Moderna, where we've always had a bit of contingency because it has not yet been reliably arriving at the times that it is supposed to, and again we've heard about delays for the next shipment as well, unfortunately. And it's not anybody's fault in this country. It is one of those things that we have to work on when we have an international supply. The AstraZeneca, as you know, was one that we were targeting for workplaces and a parallel stream, but we are now doing AstraZeneca completely through pharmacies. So if people are concerned about what vaccine they're getting, if you are going to a pharmacy and signing up for AstraZeneca, you'll be getting the AstraZeneca. The age-based program, it's Pfizer primarily, and Moderna.
Justine, do you have a follow-up?
Yes, thank you. I just want to also ask a little bit. We heard quite a bit there from the Minister of Health on the capacity in hospitals, but I'm just wondering, Dr. Henry, if you can comment on, the fact that we're now seeing this impact in hospitals. What is your feeling about the coming weeks, particularly watching the pattern in Ontario?
Yeah, obviously this is something we've been watching from the very beginning. We've presented that plan that we have for the healthcare system, and that plan still holds. So we meet every single day to talk about the impacts on what we're seeing, who we're seeing it in, and I presented last week some of the information about the percentage of people who are hospitalized, the age groups, whether we're seeing changes in that, and we are. What we're seeing is the transmission within families and communities and settings is much broader now, and that's led to our increased case numbers. So it is something that we will titrate to the system, but on a more local approach. So last March, when we didn't know what was in store, we stopped all scheduled surgeries. This way, we're able to do it with a hospital-specific approach. And one of the things that I think, that I'm very proud of, that we've done across the province, and I think kudos to our leaders in the health operations teams, is we're able to back each other up and help each other out. So when there was extreme pressures on some of the hospitals in the north, where we know resources are more constrained, patients were taken by VGH or Surrey Memorial or sent over to here to the island, and we were able to manage supporting people around the province, and that continues so that we can try and level out the resources, make sure that we have what we need in every part of the hospital system. But it's a challenging thing that we're watching every day, and I mentioned yesterday, last week I had the privilege of going to a few of the COVID hospitals that have been working flat out over this past year and a half, and I think we really have cause to be to celebrate the teamwork that they've done, and that what has helped get us through this last year, and what will continue to get us through. But we are paying very close attention to that and looking at that very carefully every day.
Minister Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. I was hoping to ask you about how bad do these numbers have to get for you to even consider now closing schools again, like they have in Ontario? Like, at what point will it get that you have to consider closing schools?
Yeah, so these are things that we, again, I've talked about this many times. We have ongoing daily conversations with the key leadership team around our schools around the province. So we look at what are the measures that need to be in place. We look at what are the options on a school and a school district basis. And my team is part of those discussions, the superintendents, the principals, the school districts, the teachers. It's a team approach to looking at this. One of the things that we know is that there are hotspots in the province where there's been increased exposure events related to transmission in the community, and that's why we prioritize school staff in Surrey School District, for example, who have all been offered immunization. And we are moving that out, as I said, to other hotspot areas around the province, and that started last week as well. So these are things that are looked at on an ongoing basis, but I will say that when we see increased transmission in the community, it's when children were not in school. And with the structured time and the important structure that school gives to families and communities is really important, and it's a less risky environment. Those are things that we need to pay attention to too. We also heard loud and clear from families across the board and from many of the educators in school systems that when we had that shutdown of schools last year, that it impacted negatively across the board. So we need to pay attention to that too, and it is finding that balance of keeping things operating safely and making sure that we are supporting children as best we can through what is really a challenging time. And challenging, I know people don't like that word. I don't know what the word is, but this is a really difficult time, and the best thing that we can do for this generation of children is to support their learning, their emotional, physical growth in school.
Follow-up, Marcella?
I do, and it's regarding what the situation is in Whistler, because I'm already hearing from people that are reporting cracks in the system with the program. I've spoken with a contractor who's reporting that his crew, who's renovating a hotel in the village right now, has been told that they're not allowed to get the shot because they're technically not employees of that hotel. So could you walk us through maybe like what are some of the growing pains that we may experience with these special programs?
Yeah, and we see this, of course, there's always exceptions with every program, but what we're focusing on in Whistler, like we did in Prince Rupert, like we did in many terraces in Tofino and other communities where we are taking this whole of community approach, that we want to minimize people who are going there because they feel they can receive vaccine. And we know the people who've been impacted in Whistler the most are the people who are working in the hotels, in the restaurants, on the ski hill. So it is not about wealthy people flying in and going on a ski vacation. It's about the people who live and work in Whistler and the outbreak that is continuing despite the many, many measures that we've taken in that community to help support that community. So there are restrictions in place that will be done through the clinics that are in place there, and it really is focused on people who live and are working in Whistler and are most at risk right now. And the details of that will change as people go through this program over the next 2 weeks.
Richard Zussman, Global News.
On the program, Dr. Henry, to reallocate Pfizer and Moderna to hotspots like Whistler, how much do you anticipate that will slow down the general age-based stream? Looking forward, how do we expect shortages of Pfizer next week, the week after? Dr. Bala mentioned that yesterday. I'm just hoping for more details about whether we are expecting that. And are there any concerns that these vaccines, Pfizer or Moderna, aren't working particularly well against certain variants?
Yeah, well, I can answer the last question first, and that's something that we look at really carefully. So yes, for every single person that we know that has been immunized and is beyond that initial period it takes for your immune system to respond, we have been doing whole genome sequencing, making sure we understand if there's been an impact. So far, we are seeing that all of the vaccines that we have are working well against the viruses that we are seeing circulating in BC right now. That includes all of the variants of concern. So that is good news. Obviously, we will continue to watch that carefully, and that's the focus of our whole genome sequencing program, one of the key foci that we'll have over the next little while. So the shipments of Pfizer that we are expecting to receive over the next few weeks, the peak was last week, this week, and next week, and then we have smaller numbers. But we also know that we have Moderna coming, and it comes in various ways. We also know that there's a whole lot more vaccine that's on order, and we don't yet have the understanding of what May is going to look like in detail. That's one of the challenges we've had with this program across the country, and it's a product of the fact that we're getting vaccines from other countries. And so it really right now what we need to do is address in every way that we can, both people by age, which we know is the highest risk, but also those hotspots and outbreaks where we can prevent transmission in the community. So it's not going to measurably slow down so much as target different people at different times. And yes, it will have an impact, but not an impact that is, it's measured in days as opposed to weeks or months. And I will say as well that the vaccine that we have, the AstraZeneca we have for people who are over age 55, this is an opportunity to get that vaccine quickly, and that will help us when we get to that age group in the coming weeks. So it is a balancing, and yes, it makes us all anxious, particularly on Monday afternoons. If Pfizer doesn't come in as scheduled, then we just need to postpone clinics. But we need to get vaccine into people's arms as quickly as we can across the province, but really focusing on those areas where there's highest risk. And that's why we've restarted, particularly first responders, looking at school staff and childcare in those areas. Just
precisely to what Dr. Baum said yesterday as well. at its height at the end of March, in that period leading into the end of March or at the beginning of April. We received in some weeks about 161,000 doses of Pfizer this week. Next week, the week after that, we're expecting about 138,060 this week, but between 138 and 139,000 doses. We expected the 105,900 doses we're getting this week of Moderna last week. We are very confident we're going to get it this week. And then next week we don't get any Moderna. So this is part of the management of it. It's not a question of a shortage. We would like to get, they could say, any number you could name, extra doses, we would take it and we would administer it right now, because there are 4.3 million people eligible, and to date, just over 1 million people have received their first dose of Pfizer or Moderna or AstraZeneca. So that's the situation right now. It's not a question of being a shortage. It's what we're expecting to get and what we're having to plan with in the next couple of weeks.
Richard, do you have a follow-up?
I do. There are a number of some concerned British Columbians who have children who are immunocompromised. Some are undergoing constant treatments at hospital and need to be in a hospital situation. And they are asking whether their parents could be considered priority for the vaccine, considering they need to be in the hospital setting. Why is this group not being considered at this point for priority?
Yeah, you know what? It is a matter of how much vaccine we have, where the highest risks are, and there are many people in that category, whether it's parents of immunocompromised children, whether it's people who are caring for an elderly person who, for whatever reason, can't be immunized or hasn't yet. There are, I would love to be able to do every group at once, but we can't. And we need to focus on how we move through that as quickly as possible. And parents of children who are immune compromised need to keep being supported to protect themselves and their children. And we will do that as best we can. And we will get people vaccine as soon as we can. Everybody will be able to get vaccine by June. So we're talking about a number of weeks now. And so right now, every person that's immunized protects all of us. So we all need to focus on that right now, on getting these hotspots taken care of, because that protects all of us as well. We know that some people, their immune system doesn't respond as well, and there's been some push that people who are older, people who have certain cancers, should be getting second doses sooner. The data is clear, and NACI came out with that as well last week with the data paper. We've been following that here. It protects everybody, the more people we have immunized. So focusing on getting our community immunized is the most important thing we need to do right now, and that will protect everybody, even if we can't mount an immune response ourselves.
Next question is from Shannon Patterson, CTV.
Oh, hi, Dr. Henry. You spoke about first responders being vaccinated, and they are in Surrey and White Rock starting today, but not in other cities like Vancouver, where the fire chief is pleading with the government to make vaccine available to her members and police in that city right now. So what would you tell Vancouver's fire chief about whether her members will be offered Pfizer and Moderna like they are in Surrey? If so, when? And if not, why not?
All fire services across the province, all police services across the province, all first responders will be getting vaccine. We need to prioritize by where the risk is greatest, and that means that some people will get it before others. We can't give it to everybody at once. We need people to be patient, to continue to do those things that they're doing to keep themselves safe, which they have been doing very effectively. I mean, we know how important these services are. We know that that's why we've been targeting these programs from the very beginning. But we need to move through this methodically, and everybody needs to be patient and support each other. Once Surrey gets done, once Abbotsford and some of the other communities are done, once we know that some of the communities in the Vancouver coastal area already have fire services and police services have been done, you are on the list. It will come to you, but we all need to sequence through over the next few weeks.
Shannon, do you have a follow-up?
The number of deaths over the weekend was actually quite high, with the vast majority of people in long-term care and even those in the community over 75 now vaccinated. Who is dying at this stage in the pandemic? Are we seeing younger people pass away, or are these still predominantly elderly people?
It is predominantly older people. We've not had a death in long-term care for quite a while now. There was one that was somebody who had recovered from infection in Chartwell in the interior. But yes, all of the unfortunate deaths over the weekend were people who were in hospital. They're mostly people in their 60s and 70s, and I'll have that data on Thursday in a bit more detail. But there have, of course, been some younger people, but it is still, we're seeing community-dwelling older people who are not yet fully protected, who are in hospital right now as well. So it's still people by age that are most at risk.
Next question is from Prabhat Sohal, Red FM.
Hello, Dr. Henry. Thank you for taking my question. I wanted to know, in India, they have extended the shelf life of AstraZeneca from 6 months to 9 months. The drug regulator there has given this permission to Serum Institute of India. Have you received any information regarding this?
Yeah, so that's something our regulator will be looking at. Right now, the expiry date of the vaccine that we're getting is generally 1 or 2 months. We had some that was short dated, and I know there was a concern that a small number of people had received a vaccine that had expired within a few days. I can tell you, I reassure you, there's a process that we have. Through the BC CDC, and we connect with the manufacturer to see if they have stability data. And as you're saying, what we're hearing from India is the vaccine is stable and works for a much longer period than initially thought. This is something that's standard for new products. So whether it's a vaccine or a medication, they're usually licensed for use for a short period of time. And then as we get more experience and we understand their stability over time, that length of time or the expiry date is extended. So that doesn't surprise me at all. And I know that Health Canada will be in touch with the Serum Institute of India to understand that. Having said that, we have not received, we are due to receive another shipment of vaccine, the Covishield, from the Serum Institute of India, but that has been delayed. So we have not yet received that, but I expect when it comes, the expiry date will have been extended.
Prabhat, do you have a follow-up?
Yes, it's regarding a different issue. We received news from the Union of Transit Workers, and they were saying that transit centers in Surrey and Burnaby, the employees there will be given the vaccine starting tomorrow. Is that confirmed?
I'm not aware that that's happening. I'm not sure where that came from. I knew there was a couple of rumors. I know that we have been using vaccine targeted at certain workplace outbreaks, but transit in general is not yet at that place where they're part of the worker program.
Next question is from Rob Brown, Dawson Creek Mirror.
Thanks for taking my call this afternoon. My question is about, again, maintaining, keeping kids obviously educated and active, but then at the same time safe. We've had a question come up here about children's groups gymnastics specifically, and if they're still allowed to be going, or if it's a case of they should not be going because it's an indoor low-intensity group exercises. So wondering specifically about that. As the first question.
Sure. So as I've said all along, we've been trying to find those balances that support especially youth to have outlets and places to go that are safe with strong COVID safety plans. So yes, we have suspended all adult indoor fitness classes across the board, so that would include dance or gymnastics for adults. But we are still supporting youth to do that in a safe way. However, If you're in a community where there's a lot of transmission, or if you're in a family that lives in a large multi-family dwelling, multi-generational home, these are the times when you can suspend some of those activities, those extracurricular activities for children, if you need to ensure that we can focus on those things that are the most important, which is school and work and keeping our hospital system open. So these are decisions that people have to make for themselves. But yes, we do allow some low-intensity classes for youth, recognizing that it is such an important outlet for young people right now.
Follow-up, Rob?
I do. It's unrelated to children's group activities, but in relation to provincial health orders not being followed, and then there have been subsequent charges, certainly in the north and elsewhere in British Columbia. Certainly a notable one up here. It looks like most of these are being thrown out of court. So, what do you say to, I guess, the efficacy of, and exactly that, the efficacy of the PHOs once they do get to court, not talking about the innocence or the guilt of the parties involved, but they seem to be thrown out. I guess how do you speak to that as far as these are provincial orders, but then they, whether they're being followed or not, they're not being recognized in any kind of court situation?
I'm actually not aware what you're talking about. All of the, there was one injunction that was sought in the interim for a hearing around churches in the Fraser Valley, but the judgment that came from Justice Hinkson on that was that these were clearly measures that were proportional and necessary in the circumstance. I'm not aware of any of the charges or fines being thrown out of court.
We have time for one more question.
On the specifics, and we can look at those. But I know there have been a number of fines, some of them quite high, and certainly some businesses have had issues as well. I know not all of them are paid yet, but that is under the public safety aspect of this response. But I'm not aware that any have been thrown out.
We have time for one more question this afternoon. For everyone listening, Dr. Henry and Minister Dix will release a statement with the latest information on cases, hospitalizations, and outbreaks, which you can find at news.gov.bc.ca. Last question today comes from Zara Premji, CBC.
Thank you. So, Dr. Henry, you said earlier that gathering with small groups outside is allowed but discouraged. Why not just ban the type of gathering again with a direct message? And you were quite direct earlier about not leaving your immediate neighborhood, but can you confirm that someone from Burnaby, for example, should not be driving to North Vancouver to go hiking?
We need people to pay attention to what are things that are safe right now. And that means if going out in your own neighborhood, going out in your own local area. It also means, yes, right now you shouldn't be going out into other areas where other people are gathering. And yes, we have said, this is part of the challenge that we have. And it's about the spirit of the restrictions that we have in place. One of them that remains in place is that not socializing with people outside your household. We recognize that that takes a toll on us over the period of time that this has been in place. And right now we need to focus on those things that we can do safely. So that means outside with a small number of people, the same small number of people. And even with that being an outlet for people, I am discouraging that, especially if it's more than a small number of people and the same number of people. So it's about trying to find things that we can do safely, and people recognizing that they need to make decisions for themselves about how to do that, and that we know what we can do here in BC. So it's not meant to parse everything apart. If you have any doubts about it, don't do it right now.
Sarah, do you have a follow-up?
Yes, and this one's for Minister Dix. So can you explain the decision to move away from announcing the age cohort who can book a COVID vaccine to announcing who can register to be notified when they can book? At best, it's been very confusing for people, and at worst, it just makes the system seem a lot less transparent. So is there a plan to start reporting regularly on what age cohorts are actually at the booking and getting vaccinated stage of this process? And obviously, can we, of course, both get both questions in French answered as well, please?
You know, this is how we're trying to manage the system with our new booking system. So it's recognizing that once you're in there to register, it's very efficient to get the booking part going. And so we have been doing both, but trying to make it clear for people, and that's our challenge, isn't it?
So I think we are making it clear. I think the information bulletin today said that everyone 66 years of age and older is receiving a booking notification, is being informed that they can book, an invitation to book in our system. I just want to take you through what the numbers are of registrations by age cohort. This is as of noon today, just to give you a sense. People from 65 to 69, we have 183,716 registrations. So, when the time comes for booking your age to be booked, if you're registered in the system, you immediately get an invitation. We have 123,796 people right now between 60 to 64, and we want to see that number rise, because in some places in the province we'll be slightly ahead of others, particularly in the north. So it's important that people 60 to 65 get registered now, and that's the purpose of telling people to get registered, and was on Saturday. From 55 to 59, and this is before, really just before you take into account of our request for people to register today, or our opening up of registrations and pushing people to register today, 66,211 people between 55 and 59 had registered. That's a total of more than 300,000. We're getting to that point. So what's critical, and this will be why we're going from 50 to 54 and then from 45 to 49 and 40 to 44. It's critical that people register. Then they can book at the earliest possible moment, and we can plan more easily. But right now, and we'll continue to inform you of this every day, every opportunity, it's 66. But in some places in BC, it's going to advance more quickly than others because of the availability of clinics and vaccines, and it's different in different places. So if you're between 55 and 64 now, you're getting very, very close to that point. It's critical to register, and that's why we're calling on everybody to register. So everybody age 55 and above today, as of today, should register for the COVID-19 vaccine. That's what we're asking for them to do today. On Wednesday, it'll be 50 plus. As we move down these age cohorts in terms of booking invitations, it's very important for everyone to be registered, and that's why we're doing it this way. The answer to your direct question in English and in French is 66 right now, but it's going down quite a bit more quickly than it did over the last week. The reason? There's 150,000 clinically vulnerable people added as of March 29th, and so those appointments slowed down the progress of the age-based campaign. Now that's moving much more quickly. So if you're in those age groups, 55 to 64, get registered today, and your invitation to book will come over the next little while. En français, je dirais que les gens qui ont 66 ans ou plus vont pouvoir vont avoir opportunité à une dose de COVID-19, et ils vont avoir une date très claire après cela, mais il faut que des gens s'enregistrent dans le système de 60 à 64 ans et de 55 à 59 ans. C'est absolument essentiel que des gens commencent et s'enregistrent dès aujourd'hui pour qu'ils puissent être en mesure de recevoir leur invitation dès que possible. C'est essentiel, et c'est pour cette raison qu'on a lancé ce système aujourd'hui pour 55, samedi pour 60, mercredi dernier pour 65. Merci beaucoup. Thank you very much. We'll see you soon.